Hi guys, it's Ken again with your last video. We just ended the sexual harassment video. This is the employee alcohol and drug abuse overdose video. And we're going to show you a little video online about some of the impacts that employee drug and alcohol issues can have on a company. And interesting when we're kind of talking about dental, and you're watching this working for a dental office. Every dental board, I will tell you, every field actually has it. We even have it in the EMS field for, let's say, EMTs or paramedics that possibly were sanctioned or they violated something as a professional and their license may have been suspended or revoked. Dentists have it as well, and most states, I know New York and New Jersey has it, they have a section in the dental board where you can look up different types of sanctions or maybe violations that certain dental offices have had. And in doing so, and I've researched it actually for the past probably about 22 years since I've actually been running and owning this company to see what really goes on out there. And I came across a couple of situations where alcohol was a couple of issues for some dentists and some other professionals that work in that dental practice. But also found it interesting where we found a couple of cases where a few dental professionals and some doctors and dentists actually lost their license or had to turn their license in because they became addicted to some of the medications and some of the drugs that they might actually have in their dental practice. So interesting. We wonder, why that happens. And one of the things that we find, especially in healthcare and dental today, because of the stressors of the job, and this, we could say this applies to any field. It could apply to anyone who works long hours, who's very fatigued, and has a lot of stress with everything that they do, and what they do. But there typically is a burnout. There is certainly a burnout potential in healthcare and dental. And sometimes, if we're doing the same thing day in and day out, it becomes very routine for us, and we may sometimes eventually actually become bored at what we do. And if we're not happy with what we're doing, we get stressed out. We need to identify that could be a sign of a potential drug or alcohol problem that could come about. Because when someone gets down on their job or they feel they've reached a dead end in their career, especially in dental and medical, and they start becoming burnout, they're going to turn to other sources. And very common today, we know all about the drug overdose, we know all about the opiates and so forth, and getting those prescriptions, obviously, for pain is a different topic. But we can discuss a lot of the antidepressants, the anti-anxieties, and we sometimes find that many of these become habit forming. If someone is having some type of, let's say, issues at work where they could use the benefit of meeting with a counselor or possibly substance abuse, or even what we call EPA, which are employee assisted programs. Actually, they call them EAP. I was calling them EPA, which is actually the Environmental Protection Agency. But these services are available for employees now through companies to help them cope with what they're dealing with. So those are known as EAP, which is the Employee Assisted Programs. But think about it. Think about like Xanax, which is very habit forming. Think about someone who may have a lot of stress on their job and work long hours. And sometimes they may want to go to a bar after they've pulled a 8 or 9 or 10-hour shift. When I worked as a New York City paramedic, I know many times I experienced burnout. As much as I enjoyed helping people, there came a point where I did it so long and I did it so often that I started to feel the burnout. And we were, advised that when we start to feel that, if we start having sleepless nights or maybe panic attacks, or maybe And, you would know more than me in the dental industry if this could happen, but certainly in emergency medicine, some of the horror that we see, some of the trauma that we see kids get hurt, things like that, it certainly can affect you. And you start finding yourself where you're taking the job home with you. You have to go back the next day or in 2 days, and you kind of dread going back. And you find yourself in a position where you start looking for relief, and drugs and alcohol are a very common thing that comes about. So another factor that we want to consider and keep in mind is if there's any other family history. If anyone in our family has had any drug or alcohol issues, we want to certainly consider that as a risk factor. But I know your employer is very concerned about your safety. They have programs that are set up. They have employee assistant programs, EAP programs. The mental health part of this is a really important issue. COVID, as we well know, has changed a lot of things. I personally know a lot of EMTs and paramedics that are still in the field. I teach at a hospital here in New Jersey. I'm required to actually teach ACLS and PALS, Pediatric Advanced Life Support. I provide those programs in our company for oral surgeons and for sedation practices. But in order to keep those certifications current, I have to be affiliated at a hospital. So I teach at Capital Health, which is in, near Trenton, New Jersey. And I know a lot of people that work that area, and they see a lot of bad stuff. And I know a lot of nurses that have been affected by the COVID. It has really affected them. So if you're in that kind of a situation, you are going to look for relief. You're going to look for medication. And the mental health issue has really come about today because they're really talking about entertaining options to increase your mental health. And part of that would have to do with hopefully preventing any type of drug or alcohol abuse or overdose. So just kind of think about that. Think about what is the potential for that to happen in the dental and healthcare industry. Do we start to see signs of that? Do we start to see that we're not enjoying our job anymore, that we're dreading going to work, that we're starting to withdraw from people? We don't want to be socially involved with people that we work with. We kind of become a loner at that point. So these are some signs and things that we'd like everyone to keep in mind. And you want to feel free to reach out. Your employer is there to help you. They actually say on average today in the United States that 1 out of every 10 person, out of every 10 people, 1 in 10 have some type of alcohol or drug abuse issue. And, there's reasons why it could come, and it could be from the job. Could be from their social life at home. So don't be afraid to reach out for that. No one's going to fault you for that. It happens. You're good people in what you do. People need help, and it's okay to reach out for that. So you want to consider all those things. Make sure where you're working. Check with your corporate human resources. Check with your supervisors to make sure what are these programs that are available for us. HR, it's funny, I've worked for a lot of people in my time before I opened my own company, and I used to always have this horrible impression that, I don't want to go to HR. HR, they're horrible people. They're gonna yell at me, or they're gonna find a way to discipline me, or they're gonna find a way to tell me I'm not doing my job correctly. And that's not the image that I think HR departments want to present. Yes, they have to be there for issues like that, but they're there to help their employees. And if employees are too afraid or not comfortable reaching out and saying, listen, I need help with a problem, I'm having a problem, what can you do for me? That's an issue. Then people become loners and they try to deal with it on their own. So any type of issue with the counseling and mental health, we really want you guys to reach out to your employer because they have those programs available. And, in the dental industry and the medical industry as well, I saw it when I worked in the field doing patient histories, finding out what kind of medications people were on. You think about what you see now. A lot of people coming into a dental practice that are on a lot of antidepressants. or they may be on Xanax, or they may be on Ambien, or a lot of what we call benzodiazepine, which is even more common, let's say, than opiate, because the opiate overdose is basically a different topic and a different course that you guys have to take in healthcare and dentistry. But we're talking about benzodiazepines. We're talking about anti-stress devices and different types of medications like that. So those are all some I don't want to say pre-warning, but some pre-information for you to try to help identify, could you become a victim of this? Could you actually end up having a drug or alcohol issue? And, as I said, COVID's changed everything. I always find it relaxing if you've had a very, very long day at work, a long shift, even owning my own company, I find it very relaxing to go to a bar and have a drink every now and then. But that's a social thing. That's a social, drinking type thing. But if you find yourself doing that every day, or you find yourself needing it and wanting it more, and very common with a lot of your antidepressant medications and some of your anti-anxieties, sometimes people feel they're not getting the benefit of that medication, so they're going to look to turn for more. And now we actually have what's called a drug dependence problem. And now we have the addiction to that. And we don't want to be drinking alcohol with those. People don't read the medication instructions on the bottles. In our dental medical emergency program that we provide, one thing we talk about is it a possibility that a patient in your dental practice or medical practice could experience a medical emergency based on medication that they're taking when they in fact didn't take it correctly. Many people will take medications improperly. They'll take it with coffee, they'll take it with tomato juice in the morning, that kind of thing. And we give examples in that course that, it could be a patient who thinks they're compliant with their medication, but they didn't get the benefit of it because they took it the wrong way, and that's because people don't read the instructions well. So these are all things that we want you to consider. We actually have a neat video that we're going to show you, which actually will help you basically identify yourself in the event that could you end up possibly becoming a victim of alcohol or drug overdose. So we're going to show you that now, and then we'll break this down and talk a little bit about it after when we go through this. So this is just a quick little information video which we find can be very helpful for people.
Drugs and alcohol are a problem in the workplace. Here are some basic facts that broadly apply in all developed countries. A large majority of adults under 70 years of age with a drug or alcohol problem are in full or part-time employment. A significant percentage of the workforce, often quoted at around 10%, suffers from a drug or alcohol problem. Of all workplace fatalities, it is estimated that between 15 and 30% can be linked, at least in part, to alcohol or other drugs. Likewise, with non-fatal accidents, the percentage is similar. And people with drug or alcohol problems are between 2 to 3 times more likely to be absent from work. So what exactly is a drug or alcohol problem in the workplace? Simply put, it is when the use of drugs or alcohol affects a person's ability to perform their role in the workplace to a satisfactory level. Often, it is identified with issues related to productivity and issues related to safety. The cost of the problem is twofold. Clearly, for the individuals concerned, the cost of a drug or alcohol dependency can be severe and can lead to short and long-term health problems, and obviously financial, social, and family issues. From the organization's point of view, lost productivity, increase in accidents, and costs related to insurance, compensation, and rehabilitation are just some of the issues that arise. So when and why should an organization become involved in the issue of drugs and alcohol in the workplace? There are three key circumstances that trigger an organizational response. First, if productivity is affected by poor performance and absenteeism, clearly the organization has some rights to address the problem and take appropriate action. Second, if the safety of anyone is put at risk, the organization has the right and obligation to ensure a safe workplace and must address the problem. And finally, as many drug and alcohol dependencies are expensive, the issues of stealing and drug dealing in the workplace clearly give the organization rights to take appropriate action. So what should an organization do to address the issue of drugs and alcohol? The starting point is to have in place a written policy for dealing with drug and alcohol problems. A written policy should be comprehensive but clear and should contain the following important points.
Okay, guys, so we're going to talk a little bit about some of the different types of symptoms that we can see, and we're going to go into that next as well.
The smell of someone's breath or clothes, bloodshot eyes, slurred words. The symptoms of alcohol or marijuana use are obvious and familiar. But what does it look like when someone is under the influence of an abused prescription drug? The symptoms of prescription drug abuse tend to be more subtle and difficult to identify. The symptoms also vary based on the prescription drug being abused. Some symptoms are visible when a person is under the influence of an abused prescription drug. For example, abusers of all prescription drugs may demonstrate excessive mood swings or hostility. Among people abusing opioid painkillers and depressants, the most common visible symptoms are confusion, drowsiness, poor coordination or clumsiness, and poor judgment. In contrast, the most common visible symptoms of stimulant abuse are agitation, irritability, and appearing to be high, unusually energetic, or revved up. Other symptoms appear as a pattern of behavior over time. You may notice increased secrecy or anger when being questioned about activities or whereabouts, apathy, loss of interest in favorite activities, or a lack of energy, change in appearance, including poor hygiene, drastic changes in eating or sleeping habits, and dramatic changes in school performance, including skipping school. What is more, there may be clues in the home that someone you know is abusing prescription drugs. These clues include cash and other valuables missing from your home, prescription drug bottles without labels or labeled with another person's name, loose pills in a pocket, purse, or bag, and missing pills from a family member's prescription, or having to refill a prescription earlier than expected. Because prescription drugs affect the brain and body, overdoses of these drugs can cause changes in heart rate, breathing, and even death. If a person is unresponsive, call 911 immediately and share your concerns about prescription drug abuse with medical professionals.
Okay, guys. So we basically can kind of see some of the different types of signs and symptoms that we might see. We might also basically get an idea that we know that people are actually having an issue with these drugs. So we want to kind of be aware of that. So So check with your employer. We definitely want you to know what the policy would be for any kind of alcohol or drug issue. What your company says is bad and what is good and what services are available. So we want to make sure that you're aware of that. And if your employer requires a drug test, legally, depending on if it's probably dental or any type of patient care where we're giving, emergency care or dental care. I know when I worked at EMS, I was subject to a urine test and a blood test, and they definitely did the drug testing on us. So you can check. I don't know if your employer has that set up, if someone has an issue with a drug or alcohol and has sought treatment and has come out of the treatment, maybe they have a policy set up where they're going to want that employee to go on regular testing. So that could be another issue as well. So that's it. Again, always check with your employer. There'll be another quiz on this course that'll be posted for you guys to also go through to complete this training. This actually will end the series of the virtual training programs that we have put together for your employer. Any of the live programs, in-person programs that we'll be doing will be your CPR training, anyone who's needing advanced cardiac life support, ACLS, or PALS, known as pediatric advanced life support, and also respiratory protection, fit testing for an N95, and dental medical emergencies. Those courses are not allowed to be provided virtually, so we'll be seeing you live for those courses. So as always, feel free to give me a call if there's any issue, any questions that you don't know the answer to. I will contact the director of HR, who I know, to get a direct answer for you. We're here to help you with all of your issues with compliance. As always, feel free to give me a call if you have any questions regarding the training. And we will see you guys again real soon. And you guys all have a good night. Thanks again.